wave of violent attacks at hospitals and clinics, particularly in rural areas, has sparked fear and protest among healthcare workers in Mpumalanga. Just this week, employees at Barberton Hospital picketed outside the facility after armed criminals stormed the premises, threatening nurses and doctors. The SA Medical Association trade union says it is not a work boycott, but a desperate plea for safety. And joining us now is Mandla Machabe, Dr. Mandla, who is the union's Mpumalanga representative, to unpack the scale of this crisis. Dr. Machabe, thank you very much for joining us on Power Lunch this afternoon.
Good afternoon, and thank you very much for having us.
So take us to the ground in Mpumalanga, right? What exactly happened at the Barberton Hospital that led to this latest protest?
Well, we'd have to acknowledge that I also report from a third person's point of view. But in a nutshell, it would seem that there were community members who brought a loved one to the hospital, and there seems to have been an altercation. And our understanding of that altercation is that it would have come from the community members who we've chosen not to identify in any name. Would refer to them as individuals of the community who then had an altercation. Seemingly it was from their side towards staff, and staff had to find cover and request for the intervention of the SAPS.
Okay, so that sounds like a bit of an isolated incident, not discounting that there are violent attacks at hospitals and clinics, but this now has led to what you're not calling a work boycott, but that staff are genuinely scared. How intense was this attack, and what's the mood now amongst nurses and doctors in Barberton?
Well, we would not want to look at it as an isolated incident because it feeds to the number of incidents that have taken place in the province of Mpumalanga.
Right.
And any isolated case would therefore be an addition to what we've experienced in the past. And as you would know, such has happened in local clinics in Ntlazeni, in Hertzeband, and in Temba Hospital. It's something that workers are taking seriously on the basis that we do not want to lose a life of a healthcare professional.
Absolutely.
Whilst they are realizing the duties for which they were employed. So the response from Barberton is necessary, and it feeds the extent of the incident that took place, and therefore workers are merely stating that they are requesting for the safety of that hospital to be insured before they can enter the premise and render service.
And what response are you getting, if anything at all, so far?
The demand tabled at Barberton Hospital specifically, because we would want to limit the conversation to Barberton,
Sure.
is that they wanted armed personnel to be deployed to the hospital, tactical response to be deployed to the hospital, and under such circumstances that makes perfect sense to say we would only feel safer if we had armed response that is in the hospital and tactical response team that is going to be stationed in Barberton, but not only servicing Barberton, also serving the local clinics, the nearby clinics that would also feel that they are not safe following the incident. Because now that the patients cannot go to Barberton Hospital, they are going to go to the surrounding clinics as they seek medical attention. So those requests were fairly basic, and we would like to acknowledge that government has come to the table, but it would seem that their response in terms of material value is still a bit lacking, because what we have requested for, we have not received. Hence, the workers are still going to work, but reporting outside the institution to say that they need their safety assured before they can go back in.
And they absolutely do need their safety assured, as all of us do in our workspaces. And you're absolutely right. We've seen a wave of this kind of violence in Mpumalanga and across the country. People are calling for armed security, even, insourcing. So from your perspective, what specific changes must be made in order to immediately protect staff?
Well, as an affiliate of COSATU, we've been calling for the insourcing of security services. Basically, we would take the responsibility from the Department of Community Safety, Security and Liaison and put it in the hands of Department of Health, which then means that security would be employed by the Department of Health, which means that we would have control over the number of security guards that we can deploy, the amount of armory that we can deploy into the hospital, and that's saving money because now we are still using the contract system, the tender system, which would see a middleman who benefits likely more than the people who are actually realizing the job on the ground. So the insourcing of the security into the Department of Health, that would effect great change. But also to say that government must respond accordingly and in the same sentiment of the incident. We cannot have guns inside a hospital and the following day you deploy security guards who do not even have pepper spray. It is disheartening for the employees. It seems as if we are taken out there to fend for ourselves, and we are actually exposed as healthcare professionals in the province of Mpumalanga of late, because it's a problem that goes beyond the borders of Barberton. It's other institutions are feeling the heat as well, and they are mobilizing as well to say, let us call government to come in account and bring us up to speed with why such a change has happened, understanding that is contractual lapsing and new contracts coming in. But why are we sacrificing and compromising the security levels that we had brought on because there were incidents in the past?
I mean, I think that idea of people coming in with guns to attack health workers and your security guards don't even have pepper spray is just so telling about many institutions across our country. We've heard that even from schools who have a similar situation. And so I wonder what the Department of Health in Mpumalanga has committed to since this incident. Are you confident that their responses are accurate, that they actually have a plan, they know how to go about and deal with this?
Not entirely. One would know of the incidents that took place in 2024 in some of the hospitals in the province, in clinics in the Hertzevanda region, or even to extend it to the broader spectrum to say even the incident that took place in Limpopo. It would seem that Department of Health's response is not up to par with the extent of the incidents that are taking place. The moment a gun enters the healthcare facility, it is deemed unsafe, and going forward, it seems as if organized labor must organize, and organized labor must mobilize and stop the services rendered at any institution whereby there is such an aggravated attack or an incident takes place of this nature. One would think that we would have learned from 2024 and years that have passed, but if we still have such situations happening in Mpumalanga, and Barberton, mind you, is a hot spot because incidents of violence have taken place before, and workers have never said we are no longer coming to work.
Yeah.
They have always come to work and requested for security to be upgraded and for security to ensure that their lives are safe when they go to render service. So you would see that, as I had said, it's not an isolated case per se, because Barberton itself has had similar incidents, maybe not to such extent, but they have seen violence from the community. And also, it is not just the Department of Health that is going to assist, it is also the community that is going to assist, because we must understand that when hospitals close, it is the poorest of the poor that are going to suffer. It is those that had to go to Barberton to receive healthcare services this week, whose lives have been put at risk as well. As we run away and find cover, it is the poorest of the poor that are going to suffer, because those who have access to medical aid can still consult. But the poor grandmother who stays next to Barberton is going to fail and now has to travel to Rob Ferreira Hospital to get just their hypertensive medication. It is a problem that the community must actively participate in to protect their interest. That is a public institution, and the community must protect it.
Well, it sounds much like a nightmare, and I commend you and those of Samatu to making sure that the fight doesn't end here. Thank you very much for giving us another update after a wave of violent attacks on hospitals and clinics, particularly in the rural areas in Mpumalanga. Dr. Mandle Matabe, thank you very much for your time.